This training is going to go over a devastating condition called macular degeneration. As a reminder, the macula is the area in the center part of the back of the eye, and macular degeneration can affect the clarity of a vision that a patient has. The macula is a pigmented spot on a retinal photo. You may see a light reflex coming off of that, which is where the fovea is. The macula allows us to see sharp central vision and color because it is highly innervated with cones. This area contains pigment in order to prevent UV damage. And for that reason, we want it, one of the pigments that it picks up particularly and it can absorb is blue light, which is very damaging to the macula. Macular degeneration is a disease that results from damage to the macula. And as we age, the damage to the macula results in central vision loss, and it can break down the retinal layers, leaving behind big fatty deposits that we call drusen. AMD, age-related macular degeneration, is a leading cause of vision loss in Americans over the age of 60s, and there's two types, dry and wet. Patients may experience vision loss centrally, and they may have a hard time seeing small print and patterns. It may be difficult to see faces. They may see a red spot in their vision in the wet form, and straight lines may become wavy and warped, and that's because if there's a fluid buildup, it can cause a distortion of the central retina. Risk factors are being a Caucasian, particularly if you have blue eyes. Women tend to be more affected than men, and it's definitely for people that are over the age of 60 most often. Genetics and obesity and smoking and exposure to UV light are all risk factors. So we test for macular degeneration by, first of all, doing an annual complete eye exam, and we look at every patient with an Optos. And what we're looking for is changes to the macular tissue. We also have an instrument that we do from time to time that's called an MPOD, and it's looking at how dense is the pigment in the macular region. For individuals who have high risk factors, we may do this test to find out if they have a decreased pigment, which may cause them to have additional risk factors. We can increase that macular pigment by the use of vitamins that have high doses of some things called zeaxanthin and lutein in them. We'll also do visual fields on these individuals to see if there's any early changes. The OCT instrument can pick up early changes as well. And more recently, we're able to use some instruments such as the diopsis machine to see if there's early changes. Many patients are sent home with an Amsler grid, which is just a grid, paper grid, to see if there's any waviness to a patient's vision. There's no cure, but we can slow the progression and even possibly improve the vision. It has a relatively good prognosis if it's caught early, which is why we tend to really be aggressive. And we want this to be detected in the dry stage because we can treat it prophylactically. Dry forms, we may be using certain types of vitamins. There's a formulation called AREDS, has high doses of CE, lutein, zeaxanthin, zinc, and copper. We also recommend our patients use UV protection, stop smoking, and have a healthy diet full of green leafy vegetables, or red, orange, and yellow vegetables as well, because they contain high doses of zeaxanthin. But many patients aren't able to get those alone out of their diet, which is why they need to have a formulation like AREDS or one of the other formulations that are out there. The wet form, our intention is to stop the leakage of blood vessels, and we may have to use an injection in the eye to do that. We may do a dye injection and then laser, where we laser the areas that are leaking. So if a patient is elderly, we want to make sure they have an eye exam to be able to detect early stages of macular degeneration. We want to emphasize the benefit of using Optos photography to monitor and track any progression, and realize that macular degeneration patients may take a bit longer in their exam, not only due to mobility issues potentially if they're very old, but also if they have a harder time seeing because of macular degeneration.